We all know that general practice is at the heart of NHS care, but every day we're coming under increasing pressure. The NHS is one of the world's most cost-effective health services, thanks to general practice. But we're juggling more and more patients, many with increasingly complex needs. The need to invest in general practice has never felt more important for the long-term sustainability of the NHS. Fortunately, the pressures we face are now recognised and improvements are underway. The General Practice Forward View is an unprecedented programme of investment to support practices to build sustainable systems for both patients and practices. The programme tackles 5 big areas in primary care. So what will this mean for general practice in the future? National funding increased in 2016 and will continue to rise until 2020. This represents a 14% real-term increase in investment in general practice services, compared to 8% for the rest of the NHS. And this will take investment in general practice from £9.6 billion a year to £12 billion a year. By 2020, we aim to increase the general practice workforce by at least 10,000. This will include 5,000 more whole-time equivalent doctors and at least 5,000 members of the wider workforce. Practices have also welcomed the increased funds for practice manager development and to widen the roles of receptionists and care navigators. For recruitment, there has been an increase in the number of medical school and GP training places. We have rolled out salary supplements for under-doctored areas and post-CCT fellowships and expanded a major recruitment drive in the UK and internationally. To try to support GPs to stay in general practice, we are also launching flexible career schemes like GP Career Plus, free career coaching for senior GPs, and the GP Health Service for mental health support. We're also working to make general practice attractive again, with reforms to the induction and refresher and retainer schemes. As far as workload is concerned, it's clear that practices need support straight away to help them cope. Expanding the workforce will help, but we need to reduce the avoidable workload as well. An important part of tackling workload is managing demand more effectively. Part of this is about supporting people to look after their own health. So, as well as improving the 111 urgent care service by adding more clinicians and bringing it online, we've launched a national programme to help patients to help themselves. This includes social prescribing, care navigation, and minor ailment schemes in pharmacies. We are also working on outside pressures by making changes to hospital contracts to reduce the follow-up requests sent to GPs. There will also be a reduction in CQC inspections for good and outstanding practices, and simplifying GP payment and reporting requirements. Investment in infrastructure remains a priority. We're putting hundreds of millions of pounds into new projects to improve or extend facilities for wider team working. And with new technology, we're already starting to transform how patients access their practice and how GPs manage their workloads. We will support much more widespread adoption of these online innovations, including extra funding for the uptake of patient online services and online consultations, which will improve access and reduce pressures on practice time. We are increasing capacity across general practice by helping practices to work together to offer more urgent and routine appointments at evenings and weekends. This will be a part of a new joined-up approach to planning, helping practice workload within core opening hours and integrated with 111 out-of-hours and urgent care services. The General Practice Development Programme is helping practices redesign the care they deliver by implementing successful innovations that release time for care. Initiatives such as enhanced self-care, active signposting, and collaborative working are better for patients and better for practices. In addition, new training and coaching programs are helping clinicians and managers drive improvements in the service. So that's just a snapshot of the General Practice Forward View in action. We know there's a lot to be done to help practices today and transform them for a better, more manageable tomorrow. We also know that even with the best plan, our success depends on us all pulling together, because it is only by working together that we'll create a sustainable future for our profession and for our patients. As we look ahead, the role of the generalist has never been more important. Now is our chance to make things better and rediscover the joy in what we do and why we do it. General practice is the jewel in the crown of the NHS. We need to keep it that way.